And welcome into this edition of ACAP Today for the first week of March 2022. I'm Jason Parent with the Aroostook County Action Program. We're pleased to welcome you into the program this week where we're going to talk about the challenges faced by community health workers in their work to serve both our communities and to interface with community health systems. We're going to get into that conversation with two researchers that are working on a community health workforce study here in the state of Maine. We'll get into that conversation in just a little bit, but before we do so, we're going to first visit with the news and information that you can use again for this first week of March 2022. We'll start with the news and information that you can use with this story. It's new to ACAP today, and that is to share with you that our partners at Maine Housing are announcing that the Section 8 Housing Choice Voucher Program is moving to a new platform. So if you are on a waiting list for housing and are part of the Section 8 Housing Choice Voucher system or want to get into it, you want to go to the Maine Housing website and make sure that you're staying active so that you can keep your application status on active assistance. If you have any challenges or have difficulty navigating the system or are unable to connect with it for whatever reason, please do call us here at ACAP. Our team of administrative specialists and navigators can help you connect with this new wait list. Otherwise, it is available through Maine Housing's website, and we certainly encourage you out there to stay current with this, as this is the new platform being used moving forward for Section 8. We also want to share with you, as you've been hearing through the other media, that there is an infant formula recall through the Food and Drug Administration with the three forms of infant formula listed there on your screen: Similac, Alimentum, and Elecare. We here through ACAP's Women, Infant, and Children's Program are a source for support for this. We are encouraging all of our WIC participants to contact our office. We know many of you have already with any and all questions. Our WIC office has formula on standby and has ordered more that will be shipped directly to us to be able to replace any questionable product that you might have out there. And we know this is of supreme importance to all of our parents of young children out there. So please do reach out and contact our WIC office. And certainly ask about this when you come in for your WIC appointment throughout Aroostook County as we connect with you on this. But we are staying on top of it, and we are a resource that can help you through this, this recall. In addition to that, we are reminding folks out there information that we've shared with you before, but that's especially poignant right now as we're facing high energy costs as well as electricity costs, that our emergency rental assistance program is available for renters throughout Aroostook County that can help pay for your rent and for your utilities at this point. There are income qualification guidelines. Those are available and visible through the MaineRentRelief.com website. You can also give us a call here at 764-3721. We'll be happy to help you navigate the online tool. We can complete the application online for you. We are encouraging, in partnership with the Agency on Aging, our seniors in the community who may have declined this program last fall when the cost of utilities was not what it is today, and said that you could probably get by at that point, to please reconsider and apply for this assistance. It is not anything that's going to count toward other assistance that you receive, but it will help you get through this very challenging time and not have to make you make very challenging choices given the fixed income situation. Again, the payment goes directly to the landlord and to the electric utility, so it's not going to show up as income to alter your home energy assistance program benefit, SNAP benefit, or others as well. And this is available for individuals living in subsidized housing or subsidized rent as well. Please do give us a call. We would be happy to help you with this application. It does take about 4 to 8 weeks to process, so we're encouraging you to get that process started now, and we will help you through it every step of the way. So thank you for considering this. We are also aware that there are many homeowners that are challenged right now, especially with the higher cost of utilities. There is a homeowner assistance fund program that is being offered through the Maine Bureau for Consumer Credit Counseling. We are awaiting final details of that. We are hearing it will launch at some point this spring, and we'll pass that information along to you as soon as we learn more. The COVID-19 number of cases is starting to go down, but we are still reminding folks that there are free at-home COVID-19 tests available, both through the federal government site. There's also the COVID-19 test access kits through the state of Maine that have 5 tests in each kit. The federal government ones have 4. We are encouraging you to check out these resources. Give us a call if you need assistance to register for those. There's sets available for each address accordingly. The list for the second set of tests, the 5 kit tests, is growing by Aroostook County municipalities. There are a select number of Aroostook County municipalities that currently can get those. The best thing to do is to go onto the website accesscovidtest.org. It'll ask you to punch in your zip code and it will let you know if your community is one eligible for those 5 tests. However, the covidtest.gov website is eligible to every address, 1 per address here throughout the United States and certainly here in the state of Maine. So we encourage you to do that. Continuing with our COVID information, we're again encouraging folks to get vaccinated and boosted. We can provide assistance in terms of registering for that vaccine appointment if you choose to go through an appointment as opposed to a walk-in situation. 764-3721, and our team will help you register online for an appointment near you. In addition to that, we are reminding folks of the free vaccine ride program, so don't let that be an impediment to getting vaccinated or boosted, and that's directly through the Department of Health and Human Services. Phone numbers there on your screen, and they ask that you call 48 hours in advance to let them know when you would like to be taken for your vaccine appointment or booster appointment. We're also reminding community members who are asked to isolate or quarantine that we are offering free COVID-19 community supports. This includes things like the most common support we're asked to provide: grocery and meal delivery. If you are asked to isolate or quarantine, please do contact us, 764-3721, or you can just Google online the COVID community supports or something to that variation. It will take you to the Maine DHHS website and you can file your request for assistance that way. We typically respond within 24 hours, including nights and weekends. So we would be happy to help you with this, to help you stay safe and to help the community stay safe at this time. We also want to remind folks that we're about halfway through the tax season right now, and if your household has a combined income of less than $58,000, our partners through the United Way of Aroostook, New Ventures Maine, and the sponsor, the County Federal Credit Union, through the Cash Coalition here in Aroostook County, are offering free tax appointments for households who fall under that income guideline. To make your appointment, you can call 211-MAINE or visit cashmaine.org. Appointments are held here in Presque Isle. We do have outreach appointments in Holton and in Fort Kent. Those are all booked at this time, but the good news is you can do this all virtually. We accept the paperwork at our offices in those distant locations, and the tax preparer will work virtually on your taxes with you and connect back with you over the phone. You bring your documents to an ACAP location where we scan them, get them to them, and return them to you at that point, and we're happy to help you with that. But first, please do register for an appointment. Again, 211. Dial 211 or visit cashmaine.org to schedule your appointment. And again, the appointments are running through just before mid-April, so please do consider applying or getting that appointment in now as the clock is ticking. We also are reminding folks, we talked about the cost of energy earlier. The Home Energy Assistance Program is the best recourse to help with your cost of energy. If you meet the income eligibility guidelines or come close to meeting those on your screen, for your household size, whether you're looking back at 1 month, 3 months, or 12 months of income, please do give us a call. Even if you're close and on the margins with that, we can work with you in terms of deducting medical expenses and other critical expenses. This is a great time to look for a Home Energy Assistance Program appointment. If you haven't done so in a number of years or never have done so, please do consider doing that. Our scheduled appointments run through about mid-March at this point, so our availability does open up at the end of March and into April, May, and even June. It's a great time to apply. Any benefit that you get will stay on your fuel vendor account for up to 18 months or until you exhaust it. And really, if your household income has changed at all, even within the last month, that's why the income qualification guidelines do extend back that short a window, which is really helpful to folks right now. We are also planning to do some more outreach in the communities in the months of April, May, and into June, where we're going to do some on-site applications in different communities, and we'll be getting more information out to folks about that. If you'd like us to visit your community, we will be there in those months as we look forward to getting through these already previously scheduled appointments on our calendar this month. We also want to remind folks out there that if you are experiencing homelessness or housing insecurity of any kind, or just need a warming shelter during the day, ACAP's Hope and Prosperity Resource Center at our 1 Edgemont Drive location is available Monday through Friday from 8 a.m. to 5 p.m. We are working as a community collaborative with the Aroostook County homeless stakeholders on the housing homelessness crisis that we have in our community right now. We have over 100 individuals who are staying between our local area homeless shelter and who are housed in hotels through ACAP, through the Emergency Rental Assistance Program. The Hope and Prosperity Resource Center is a great resource. We're helping individuals find employment, connect with education opportunities, and find housing, which is proving to be the greater of those challenges at this point. We encourage you to reach out to us. We provide a noontime meal and snacks, access to online resources, and access to coaching staff available there throughout the day. We encourage you to please reach out to us or just drop by between 8 a.m. and 5 p.m. We can also help complete the application to get into the area homeless shelter when space is available, or provide hotel accommodations as needed and as available. As you can imagine right now, during the winter snowmobiling season, there are fewer hotel rooms available at our disposal at this point right now in Aroostook County. So we are working on creative solutions with our partners, and we thank them very much for their assistance as we navigate these challenging times for individuals experiencing homelessness in Aroostook County. And finally, in this week's news and information you can use, if we've not talked about something here and you are in need of any assistance to help get through the pandemic or to help get through a challenging period of time economically, we understand that there are a lot of economic pressures right now. Please do reach out to us. We have a team of navigators standing by who can help connect you either with our services or with services of community partners, and just listen to what your needs might be and help you troubleshoot those in a collaborative fashion. So we appreciate the work that they're doing, and we appreciate you who are reaching out to us. We understand that times are challenging right now for many, and we want to be a resource to help you navigate these very challenging times, and our ACAP navigators are a critical resource to be able to do that. And that's this week's news and information that you can use for this week, the first week of March 2022. I am now pleased to welcome to our program for our feature interview today, Katherine Weatherford, darling, and Timothy Whiton, who are both with the University of Maine Community Health Workforce Study. They're researchers who are working on this project, and I'm so pleased to have you both on the program. This is your first visit on ACAP today, so welcome.
Thanks for having us.
Thanks, Jason. It's wonderful to be here.
Well, great. I'm so pleased to have you with us. We've been talking about this study. We've been sharing some of our materials out there publicly. And so I'm glad to have you here to provide some context for our viewers on this project and what it's all about. And so, Katherine, why don't we start right in with that point right there and share with the community what the Community Health Workforce Study and the research you're all doing is about.
Sure. Thanks so much. It's great to get a chance to talk about this project, especially with community members across the state who work with community health workers and navigators to help folks stabilize social needs and listen to the needs and concerns of community members. So a community health worker is a frontline public health worker who is respected and trusted by the community that they serve and helps to address socioeconomic needs, as well as language and culture issues of their community when it comes to interacting with health systems or addressing core social service or basic social needs like housing, transportation, education, and employment. So this project has been developed in partnership with Maine Community Health Worker Initiative that's been around for many years, working to strengthen the community health worker workforce and help organizations and healthcare teams really integrate navigators or outreach workers into the work that they do. So there's many different job titles that community health workers work under, right? But really that core community membership and trust, it has always been kind of at the center of the roles that they play across the context that they work in, including schools, health systems, or community organizations.
Great, Catherine. I think that's where I'm going to pick up with Tim on. And you just mentioned there are a number of different individuals who can identify as a community health worker. Tim, you're Aroostook County based here, and so maybe you can help us as we're reaching, we do reach a wider audience than just Aroostook County through ACAP today, but its primary audience is Aroostook County. And maybe you can help provide us a little bit more context where I may not think of myself as a community health worker because that's not my title, but who are community health workers here in Aroostook County, and who do we want to make sure engages in this research opportunity?
Yeah, thanks, Jason. That's a great question, and definitely the one of the highlights of these interviews that we're doing is that we have a lot of folks whose job titles are not community health workers. And so it fits a pretty wide spectrum of folks. So we have interviewed a few folks whose job titles are community health workers, but those job titles have changed recently to that, from something like patient navigator or community coordinator. Some of the folks that we've interviewed from Southern Maine, they might work in a hospital setting, either on a contract basis or also sort of on a sort of a constant regular basis, but they're translators essentially. And so they're working as specific translators in hospitals and other medical settings for immigrant populations primarily. And I would say that would be one of the first and maybe overlooked spots that somebody here in the county could work, could be considered a community health worker, is that there's a large Latin American population that are coming, immigrant population for seasonal work, but they're still pretty plugged in to what's going on in the community. So and then there's also lots of other folks, not just translators or working with itinerant populations, but yeah, I mean, there's lots of people doing lots of different community things. I know ACAP employs folks that would be considered CHWs, whether they're doing tobacco awareness and education and things like that, or other drug awareness programs. Yeah, I do know that ACAP hires quite a few individuals for that type of work, and those folks would be considered CHWs and be the type of people we would love to talk with.
So Tim, it really is the broader definition in terms of outreach into social determinants of health. So the term health is an operative word, but community is certainly the key here. Community is the underlying part.
Yes, yeah, very much so. And people, we've interviewed a few folks that even their jobs specifically may not necessarily count as CHWs, but the volunteer work that they do even would be considered a CHW, which has been a really fascinating part. And so that they are technically CHWs sort of in the work that they do, but a lot of the work they're doing with particularly immigrant populations or underserved populations, they're doing a little bit on their own time, or there's sort of this muddling of the boundaries, which most health workers experience. So certainly if anybody's involved in helping people, particularly with health-related things, they really kind of fundamentally meet that CHW definition.
So just to clarify, Tim, I was just in the news segment there, I ended with a segment about our navigators, our team of navigators who are helping connect people with services. Oftentimes, those are certainly social determinants of health related. Someone like that would be considered a community health worker?
Yes.
Yeah, absolutely.
Great. Kate, before I come back to you, I did want to just take a moment to check in with Tim on the components of this study. I mean, there's obviously, you mentioned that you've been doing some interviews, so that's a clear component of it. So just maybe walk us through what this study and the research work you're doing entails.
Yeah, so this isn't exactly my background. My background is more as a historian of sport and recreation. So I kind of fell into this project. So I'm still figuring out what Kate's full scope of plans are, and I'm sure she'll fill you in a little bit on that. So I started in October, and my role right now in the project that we're working on right now is an interview project, essentially, with CHWs across the state. And so the goal is to find a balance between all the counties, because the health experience, both for individuals, but also for the worker experience, is unique by county. We're trying to find a balance between urban and rural settings as well, which of course is a challenge because you might have a CHW that lives in Bangor but works in very rural part of the state, or even vice versa. So we're still figuring that piece out. But so we're looking for 2 individuals, ideally from each county, with a balance between rural and urban. And then we're doing 60 to 90-minute interviews, talking about kind of everything, whether it's who they're working with and what types of work they're doing, to their own experiences, their pay, whether they're supported, how they feel like their institution and communities are valuing them or not valuing them. So yeah, we're kind of getting the whole spread of the potential CHW and community health in general gamut. And then we're running a various amount of qualitative data on those interviews. And if anybody participates in these interviews too, one important part to know is that we de-identify everything. So if it was an ACAP employee, we would make sure that they're not identified as ACAP, even though I know they would have wonderful things to say and such. But certainly, yes, there's we will be the only people that know, and even as we get towards the data running stage, we won't know who's saying what. So yeah, that's kind of the quick and dirty. I know that the project is, hopefully, fingers crossed, we'll know in a week or so, going to expand and continue to grow. But for right now, it is primarily an interview-based project.
Great. So Kate, maybe take us from that point forward. What happens with this information, and sort of help us round out what this is all about.
Yeah, absolutely. So as Tim mentioned, we're interviewing people who work as CHWs in Maine, but we're also interviewing policymakers in the state and across the country about how these models have helped communities address social needs and social and structural determinants of health, right, within communities, but also within health systems. And so when we analyze those findings together and with our community partners, we'll do a couple different things. One is we'll work with partners and key stakeholders to develop some recommendations, right, about what kinds of supervisory structures or team-based structures help CHWs integrate into care teams, or help CHWs address social determinants of health or complexities of the healthcare system, right? And then also, what are some sort of workforce development strategies that help make and financing strategies that make these models sustainable for communities, right? So that could be a number of things, like using value-based purchasing strategies in our healthcare system to help fund positions on social determinants of health, or other kinds of reimbursement models or state funding programming models to make sure this kind of work is sustainable for the people who are doing it, as well as sustainable for our health system, right? Because we know those core social determinants of health are huge drivers of our health status, right? And so everything we can do to help rebuild trust between communities and providers, as well as stabilize social determinants of health, helps our health systems stay stronger and more financially viable. So we're hoping that these findings will help us not only improve career pathways and professional development strategies for the healthcare workforce, right, but also for the healthcare system to be more attuned to what's really driving people's health status, right, their basic needs, and the challenges involved in maintaining, right, housing, employment, education, as well as maintaining and navigating the health system, right, which can be really, really complex, especially as people change income or change insurance or have to get things re-verified or have to travel to specialists, right, that there's a lot of steps, right, where having someone trusted to walk along with you can really ease that process.
And I've heard you say, and I want to dive into that in just a bit, that there's a lot of foundational trust and the need to maybe even rebuild some of that trust in what we've seen in recent years, and even perhaps beyond that. But just quickly for folks who are out there who are considering, gosh, I think I have something that I want to lend to this conversation, and participating in a 60 to 90 minute interview is something that I might have not saying that that's a bad thing, but I might have some interest in, but maybe an example of a few examples of some of the questions that they might want to be thinking about, and how, so the questions that they would be expected to be asked in that interview.
Yeah, absolutely. So we asked a lot of questions about what are the challenges that their clients or communities face, right? So what are they, when they're listening, right, and walking along with folks, what are the core challenges that they face, right? And what makes it difficult for a community health worker to address those challenges, right? So you talked about housing in the earlier part of the segment, right? And there's so many complex issues with housing. There's just the complexity of getting eligible and getting on the wait list, right? But there's also these upstream issues of housing affordability and kind of the housing crisis, right? And so we're really talking to people about how they deal with both of those, kind of like what's the upstream root structure of the issues that their clients are facing, right? And how do they sort of deal with, as community health workers, deal with addressing those needs with folks. And then I think the other core piece is, what does it take to build trust or rebuild trust with communities? And I think a lot of it's sort of easy to see cultural differences when there are language differences between healthcare providers and clients, right? But we also know there's a lot of big cultural divides and social divides, right, between patients and providers who maybe share racial, ethnic background or share language, right? And that there is a lot of broken trust with health systems across the US and in many communities, that really having someone that understands the community context can be really important to helping folks navigate healthcare decision-making and make sense of medical information, right? Which we know is changing all the time and things like that. So we ask about those kind of questions of like, how are CHWs navigating it on the ground? What would make it easier for them to do their job? And then also, what are the kinds of skills, training, and knowledge that they would be interested in pursuing, right? I think one of the important pieces about the CHW workforce is that many people who have trusted relationships with communities can provide a really valuable and vital role in our health system, right? But that can also be a stepping stone to other kinds of careers and pathways that provide other kinds of employment that folks might not immediately have access to. And so we're really interested in helping to strengthen those career pathways, whether it's going back to college or pursuing a healthcare career or pursuing another kind of advanced degree, or developing their own skills as a community organizer and a community health worker in that kind of basic public health frontline, which we know and we've learned over the past three years, right, is so critical to addressing public health crises and as well as the ongoing crises that so many of our communities are experiencing around housing, food insecurity, and financial security.
Great. So Kate, I want to come back to you and talk about that in the context of the pandemic for just a minute. But Tim, I just want to, what I'm hearing Kate say, and I think is important to underscore for community health workers in Aroostook County to understand, is that the data that you're collecting, when people hear about a research study, they think, gosh, the answers are going to be found in a spreadsheet or they're very scientific. But what I'm hearing from what Kate is saying is these are experiential based opportunities. Practical, this is what we're seeing, what we're experiencing, this is what my individuals who I'm helping in the community are navigating and dealing with every day. So this is very real, very practical, and there's not necessarily any wrong answers in this particular case.
Yeah, it's more of a conversation than anything. We certainly have what we're looking for in terms of responses, but there's no right answer, there's no wrong answer. I would say we did one this morning that I would say was pretty different than other ones in some ways that I won't elaborate on, but yeah, it's about the person's experience and the community that they are in, those people's experience. So yeah, there's nothing here that there's no political agenda, if you will, to extrapolate one type of response or one type of answer that then gets turned into some sort of policy. The idea is to really see what the experience is like, see what's really needed by people. That's oftentimes ignored by some of the political discourse, and then hopefully translate that back into some meaningful policy.
That's actually some great context and leads me directly back to you, Kate, in terms of picking up on the conversation from that point. It seems like anything that we discussed today is both shared in the context of the pandemic and sort of the parallel political dynamics that have run as a result of that, including the challenges with confidence in public health and related decisions and discussions and the polarization around that. How much of what you're looking to learn, and maybe the answer is what the study leads you to, but it is related to the contextual occurrence of the pandemic and those related items.
Sure. I mean, I think that there's a sort of a spectrum, right? And I mentioned earlier that we're kind of dealing with some pretty layered crises right now as a state. And in our communities, right? So we have an ongoing pandemic, and we also have multiple crises around overdose deaths, housing, right? Really, really ongoing issues that have also been exacerbated by the challenges of the last 3 years, right? And I think one of the things that those challenges have taught us, right, is that core importance, like the critical importance, right, of having trusted sources of support and knowledge, right, in our communities. And really we're only as able to respond to crises as we invest in folks that are trusted and give those folks the tools to serve their community needs, right? Because they know they're the closest to what communities need and what messages, right, are going to resonate, right? What information people are looking for, what concerns they're raising, and how those concerns can be addressed, right? Whether it's questions about information being shared when applying for social services, or questions about the effects of vaccines, or questions about the need for testing and quarantine, right? That folks who are on the ground hearing what community concerns are, right, know what the best strategies are going to be to prevent an overdose, right, or get folks access to the services that they need. And I think that lesson has been really clear, right, and has really amplified the need for trusted frontline public health workers, and the need to support those people to prevent burnout, right, to allow them to kind of continue to be showing up for their communities. And I think those are the sort of two core questions that we've been really wanting to bring into the future is, right, how do we support this workforce, prevent burnout, protect their mental health, right, and emphasize to policymakers and providers, right, that so much of what impacts our health happens outside the clinic, right, and that our clinicians, who are often wonderful and fabulous, do have often have a separation, right, between the sort of lived reality of communities and what they're seeing, right, in their offices. So
all very real considerations, and I think I'm anxious, as others must be, from hearing this conversation and what's going into this work, to learn about the component that you just talked about, and that's the future. And so, what is the future of what happens with this information gathering and research that the two of you and others across the state are working on?
Yeah, that's great. So in our research, and as you kind of alluded to earlier, we take a really practice-based and engaged approach to not only designing our questions, right, or as thinking about who we need to talk to, how we need to analyze this data, but we're also bring those initial findings back to check them, right, with our community partners. And so that includes the Maine Community Health Worker Initiative, the Maine Public Health Association, New Mainers Public Health Initiative, and Partnership for Children's Oral Health, all of organizations that have been really key in developing this workforce, right, and thinking about the future. And so we're really eager to develop our analysis and our recommendations alongside, right, our partners, as well as community health workers across the state. So we'll be doing listening sessions or member checking sessions before we, write up or develop any sort of synthesis of what we learned, right? Because this is really a project that is about trying to elevate community knowledge, right? And we know our frontline public health workers and community health workers are really critical, have really critical insights, right, about community needs, but also about the systems barriers that we need to kind of take down to keep people healthy and maintain their access to healthcare. So that's the that community engaged approach really helps us kind of think about what the big picture impact of what these findings could inform.
One thought that just crossed my mind as you were saying that, Kate, is as we look at, sort of other studies, and granted they are very different and they have some very quantifiable data connected with them. Are there benchmarks? Is there a benchmark for this work? Because I know we do community needs assessment here with community action agencies. You have the community health needs assessments that the hospital systems do, Maine Youth Integrated Health. We use all of these and we benchmark from review cycle to review cycle. Do you have a benchmark that you're comparing this work to, or are you really plowing new ground here?
That's a really good question. And we have students working on this right now, right? Because we know that there has been a ramp up in investment in community health worker funding. And we know really great things about what the impact of community health workers can be on helping somebody control their blood sugar levels or maintain their A1C, or how many hospital visits they can prevent, things like this, right? And those kinds of benchmarks are important to maintaining, to sort of proving the economic viability of this model, right? But we're also really interested in what are the performance metrics that really matter to CHWs and to their communities, right? So is it documenting processes of policy change, right? Or practice change, right? Removing, for example, stigmatizing questions, or changing no-show policies in ways that make visits more accessible, things like this, right? So how do we sort of benchmark, as you said it, right, the performance or the outcome or impact of CHWs, right? What do we want to organizations and health systems to be able to collect data on, right, to show that the health of communities are improving, and right, that that there's impact, community level impact, right, beyond the sort of cost savings or health outcomes data that we would want to be tracking on an individual level. So that's definitely part of what we hope our findings can help inform. And it's absolutely a question that the CHW initiative and our state partners, you guys, are interested in as well, right? As we do start to invest and see the value of these roles.
So Katherine, that might be our indication that we may have taken the conversation a little bit too long, because there's so many different pathways we could take into this conversation, and
Absolutely.
very interesting. So I want to make sure that we circle back though before we let you go, and certainly if you need to step away for a moment or to bring somebody in.
I think we're good. I think we're good. Thank you.
I've seen the CBS morning segment where Vivek Murphy has his child, all of a sudden that pops up. So if it happens on national television, we welcome it here on ACAP today. And Tim, I know that you have a young household there, including a new baby, so congratulations on that. But I want to circle back with both of you before I let you go to have you share with me anything that we haven't talked about that's really important that gets out there to folks about the work that you're doing. Kate, let me start with you.
Yeah, sure. I mean, I think the most important thing is that we really want to hear from community health workers and navigators who are doing this work, right? Because they know the needs of the communities and the systems changes that are needed. And this is a really great time to be getting involved in the state level CHW initiative, as well as a specific study opportunity. And it was really important to us to have gift cards available to help support folks' time to participate, because we know your time is so valuable. So we do have $50 gift cards to be able to send folks who do participate in the study.
We see that here on the screen. We also see the opportunities to learn more and to sign up now to be a part of it. So certainly encourage folks to connect. Tim, you've been conducting some of the interviews. What are your last thoughts and last words?
I think it's been really awesome. It's been really enjoyable to listen to a lot of different people. And like I've said so far, we've got a lot of different experiences, folks volunteering, people working in a variety of different capacities. And, there's a lot of similar threads about people really wanting to help others, help their communities. But then there's a lot of different experiences and a lot of different interests and backgrounds. So it's been really enjoyable to hear from a lot of different people across the state. And right now we are very much looking for people from the county and some of the other neighboring rural areas. So we would love to hear from you and chat with you at some point.
Well, I want to thank you both for your patience and thank your families for understanding, and I was welcome that cameo, Katherine. Thank you so much for reminding us the reason why we do what we do each and every day, right? And also reminding folks of the realities of work in this current day, which include making sure that we care for each other and our families first. So glad to have that as a reminder of why we do what we do. So thank you both. Appreciate the conversation. Before we leave our viewers today, just a reminder that if you consider yourself someone who's interested in potentially being a community health worker and joining our team, not all of these positions are community health workers, but many of them are. We have a number of current openings across Aroostook County. We're a growing organization, and I think that the work that we do is very rewarding. And I think many of our team members would say the same, whether they're being interviewed by Tim or meeting me in the hallway at any one of our locations. Again, positions open from Dyer Brook all the way up into Caribou, not in the St. John Valley at this time right now, but certainly do consider applying, going online, visiting us at acap-me.org or checking out positions on ACAP's Facebook presence. And lastly, as we do at each point before we close out our broadcast, we provide you with a snapshot of the week. And since the beginning of this year, we've been doing a throwback snapshot of the week in celebration of ACAP's 50th anniversary. These are two of our longtime ACAP team members, are very important, as we call them VIPs, because of the amount of time that they have spent dedicating their work to being community health workers in their own right. Sandy Williams and Kathy Williams enjoying one of our Agency Day celebrations, always a highlight of the year, where we bring our entire team together one day a year, where we have all 200 or so folks together in one room. And we've missed doing those through the pandemic this last couple of years. Hopefully things will continue to improve so we can bring our team of 200 strong across Aroostook County together at the end of August typically. But thank you to Kathy, thank you to Sandy, thank you to all of our hardworking ACAP team members out there doing great work to help ensure that all of our community members in Aroostook County, especially those most vulnerable, are served at this very challenging time. With that, thank you for joining us, and we'll be back next week with another edition of ACAP Today. And be on the lookout. In a couple of weeks, we're going to have one current and 2 former board chairs in another one of our 50th anniversary specials, talking about the impact of this agency and the people of Aroostook County over the past 5 decades. We're looking forward to that conversation with Dana Connors, Steve Richard, and Trudy Gorno in just a couple of weeks, but we'll be back next week with another edition. See you then.